And now, it's BoomerLife, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is BoomerLife on CIL 650.
Doctor, give me the news. I got a bad case of loving you.
And welcome to the show here on BoomerLife. I'm Zach Spencer, and today we're talking about something that affects most people, snoring. I'm sure there's a lot of people listening right now are like, snoring, turn up the radio. My husband, my wife, somebody snores, and it can really affect your health. You know, a good quality sleep is critical to your overall health and well-being. If untreated, obstructive sleep apnea has severe health consequences, including high risk of high blood pressure, gastric reflux, heart attack, stroke, and even early death. And joining me in studio is the SnoreDentist. I've never met a SnoreDentist before. So Dr. Charnel Muir, welcome to the show.
Thank you very much, Zach.
You have this on your license plate, is that true?
I have. My license plate actually says Snore Doctor.
Do people stop you in gas stations in the Safeway parking lot?
I do. Often the bed partner disrupted by the snorer is the one that knocks on the car window.
Mm-hmm. And we're going to get into a little bit more, but it's a very specialized practice of dentistry. There's not very many of you who specialize in this, right?
That's right. And there's very few of us that have practices that only do what's called dental sleep medicine. And we provide oral appliance therapy for snoring and sleep apnea. And there was about 5 of us in the province that are actually called diplomats of dental sleep medicine. And 1 has retired this year. 2 are in the process of retiring. So it only leaves about 2 of us in the province.
Now, I joked at the beginning that, you know, people are listening going, wait a sec, this show's about snoring? I got to listen to this. How prevalent is snoring in our population? Like, I snore, I know. I've never heard it myself, but my wife tells me I snore. My kids tell me I snore. So is that pretty common that one of the 2 partners snores?
It is. It's quite common. We really don't know the percentages because often it goes unreported. Yeah. But really it's anywhere from 3 to 20% of the population, and it'll depend on age and gender.
I would think it'd be higher than that.
Well, it could be situation
right?
As you age.
Right.
That's right. They say it could be up to 45% of the population as we age.
So give me a little background. When did you start practicing dentistry, and how did you morph into this very specialized area of dentistry? Well,
graduated UBC School of Dentistry in 1987, so that would be 29 years ago. When I was at UBC in the 80s, was very fascinated with growth and development, especially in children, and airways and how patients were breathing, whether or not they had constricted arches and crowded teeth. So it was a focus of mine early on. I ended up having a nephew who had obstructive sleep apnea at the age of 7. So became very interested in that. But when I graduated dental school, I did a lot of braces in my practice, and I would often ask Mom if little Johnny snored, and she would say yes, but not nearly as loud as his dad.
Right.
What can you help me with that?
It's funny because my youngest snores.
Yes.
He breathes heavily. I don't know what you would call it.
Yeah.
But, so it runs in family.
It does. It does have a genetic component. So you'll kind of inherit the physiology of the snoring or the airway that collapses. And then you can add on top of that different things like age or weight or some cocktails in the evening or anything like that makes it worse.
So how did you find out about this area of dentistry?
Well, way back in the 80s, the head of the orthodontic department at the time was a Dr. Alan Lowe, and he went on to develop one of the very first ever appliances, and UBC has actually done a lot of research in dental sleep medicine. So I was keenly aware of what was going on in my own backyard, followed it very closely, and then started taking extra courses, became involved in what's called the American Academy of Dental Sleep Medicine, and did a lot of training and educating with them, began treating patients, and then did what's called the diplomat from the American Board of Dental Sleep Medicine.
We had Dr. Fleetum on at UBC, the sleep, what's the clinic?
Sleep physician, yeah.
Yeah, and he was telling me that Vancouver, along with Boston, are two areas of excellence in sleep clinics worldwide.
Worldwide.
So
yeah.
why Vancouver?
It just seems to be something that we've had clinicians that have had a high interest in. Yeah, for sure. And from the sleep physician's perspective, they'll look at all 85 different sleep disorders. I, in my practice, deal only with sleep breathing, so obstructive sleep apnea and snoring.
So the SnoreDentist practice is where? Where's your practice?
My main practice is in North Vancouver, and I practice there any number of days each week. And then I also visit different clinics. One is on West Broadway there once a month. I sometimes go out to the Valley. And then I actually go over to Vancouver Island and I see patients all the way from Victoria to Campbell River. And I do that 1 week every month.
So are you there to do the fitting? Is that what is that the real secret sauce to getting this right?
Yeah, it's quite a specialized knowledge in trying to figure out how to take that exact bite and taking that bite on that patient, because the oral appliance's main function is to hold that lower jaw slightly forward and keep that airway open.
All right, I don't want to go back to the very basics, okay? What is snoring and what is happening when we're snoring?
So snoring is, simply put, a collapse of the usually soft palate and the base of the tongue. So when you go to sleep, they relax a little too much. They get a little too close, and that air turbulence causes that tissue to flutter. So that's the normal cause of snoring. Now, the air turbulence can also be caused by air coming through your nose. But the most common tissues involved would be the back of that throat area.
Men more than women?
Men more than women. Usually the numbers are given in the range of 3 to 4 men to every 1 woman. Until women go through menopause, and then we catch up. Yeah, we tend to, I've heard some studies say even double rate of snoring after menopause. So we see an almost 2 to 1 ratio.
Now, we in the public probably take this as a bit of a joke, a bit of a lark. Oh, everybody snores, I snore, ha, ha, ha. But it's something we should take seriously.
It is, for 2 reasons. Well, mainly, we're disrupting our bed partners. We can also be disrupting our own oxygen with snoring. But it's also a continuum. It can be a sign of what's called obstructive sleep apnea, where the airway is not just fluttering and snoring, it's actually closing and the air is not going through.
Now, you can have sleep apnea where you will go over a minute without getting any air, right? Can you explain to us the extremes of this?
Yeah, we'll often see patients of the 2 extremes, and then most are in the middle. So one extreme would be someone who has a lot of stoppages of airway, but they're shorter. So they have to be at least 10 seconds, but say they're 15 seconds. And then we'll see the other extreme where someone doesn't have as many stoppages, but they could be up to a minute long.
So no air for a minute?
No air. And if you voluntarily tried to hold your breath that long, you wouldn't be able to do it.
Yeah.
Yeah.
Yeah, my kids do that. They say, how long can I hold my breath underwater? And it's usually 20, 30 seconds, and it's uncomfortable.
Yeah.
So when you're sleeping, you have no choice.
You have no choice.
Okay. Now, what about the signs that you're there? Is it you're sleeping in another room? Is that a good one?
Well, there's lots of things. People will often get bumped by elbows or kicked in the rear end and rolled over by their bed partner. They may end up sleeping in the other room, or they'll wake up in the morning and their bed partner's not there anymore. Or they'll wake up with a headache, or they feel like they've got a sore throat. Maybe it's the start of a cold, but it's not. It's just that snoring has caused the tissues to be sore in the back of the throat. They may wake up tired. They're not feeling like they had a good sleep. So any of those can be signs.
Now, do most people that snore and have some level of sleep apnea, is it every night? Or will they get a good night's sleep once in a while?
Well, there'll be a baseline they'll always have, but it can be worse at night. So certain nights can be worse. Like I mentioned, if there's alcohol in the evening, definitely worse. We all learned we snore more when we drink. That was a college thing that you learned. Certainly can be worse with different allergies. It can,
times of year, right?
Yeah, times of year. It can also be worth like air condition different humidities, sometimes forest fires, if there's smoke in the air. I'll often hear patients tell me they snore more when they go camping, and it's because of the fresh air and they're outdoors. And I'm like, no, it's because you sat around a campfire for 8 hours.
Is there a relationship between smoking and asthma, for example? Do people with asthma snore more or less, or people who smoke more or less?
Smoking can cause more snoring because the smoking itself irritates the tissues.
Sure.
So it causes inflammation in the airway. And, the closer the tissues are, they're more likely to rattle. Asthma has an interesting connection with sleep apnea and that, but we don't fully understand that yet.
It seems to me that we're only really hearing these things in the last 15 to 20 years as a layperson. You're obviously been studying this for many years, but sleep apnea, CPAP machines, devices you can put in your mouth. It seems to me that this is all coming to a head recently. Is that just my perception?
No, I think that's true. I think we know more now of the connection to what they have to our health consequences and the connection they have, snoring and sleep apnea, to other conditions like heart disease and heart attacks and high blood pressure and diabetes.
All right. Well, that's good that you led into all of those things, because I want to pick up what does sleep apnea do to you over a long period of time, and how harmful it can actually be to you. And then we'll get into the CPAP machines and then the oral devices. So we have with us today the SnoreDentist, one of soon to maybe be two people in the province to do this. In North Vancouver, Dr. Charnel Muir joins us in studio, and we'll continue talking about snoring. It affects almost everybody at some point in their life. Next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.